Welcome back, sleep audience. Welcome to my video 7 of 8 of the insomnia treatment videos that I have prepared for my patients and my audience who have insomnia symptoms. So video 7, we're going to talk about positional therapy and how it plays an important part in helping you sleep. My name, again, is Valerie Williams. I'm a nurse practitioner working in a sleep lab in Southern California as an insomnia specialist. So why is positional therapy or sleep posture so important? Well, what happens is that if your body is not in a neutral position or aligned correctly, it will increase your pain levels. Okay, a lot of people have chronic pain, and anytime your body is not supported in a neutral position or is not in a neutral position when you sleep, it will increase your pain levels. Okay, your spine is very important. It's kind of divides your body into the right and left side. And if you look at your profile in the mirror, you're going to see that your spine has a natural S-curve, and it's made that way specifically to be able to support the bigger areas of your upper body. That includes your lungs and other vital organs to make room for them, and then also your lower body that it extends into the hip area. So what we want to do is make sure that you understand some of the different techniques and different appliances or pillows or support systems that are out there that might help you to be able to stay in a neutral position, which is having your spine straight up and down. Okay, and that's just starting from the top of your head, just going down straight. That would be a neutral position for your spine. And then supporting it in that position while you're sleeping to decrease your pain levels. So a lot of people will have a cervical neck pain or maybe shoulder pain, and they found it very helpful sometimes to purchase and use a cervical pillow. But we have to make sure that people understand that anytime your cervical neck area is pushed too far forward, okay, flexed too forward, or hyperextended, it puts a lot of strain starting at the very beginning part of your spine, which is your cervical spine area, and it causes your whole spine then to be out of a neutral position. So you want to make sure you do your due diligence and find something that keeps your head and your cervical spine and the rest of your spine aligned in a neutral position. And if you go ahead and look at the slide on the bottom left-hand corner, that's the position that your head needs to be in if you're using a cervical pillow and it's the right size for your support. Okay. The other thing is that people with lower back pain, and it's not a secret that if you elevate your lower extremities, your lower legs, that it takes pressure off your lower back. So something that we have found helpful to tell our patients about, instead of using pillows that can actually dislodge and move, and therefore, cause you to have pain later during the night when they do move their position. People sometimes can use a wedge. Okay, so it's called a lower extremity wedge, and it's in the top right picture is a picture of the wedge. And what's good about it is that it's a foam inside, and then it has kind of a nice cloth on the outside that's non-sliding, so that when you put it on your bed and put the weight of your legs on it, it doesn't move, so that it gives you then consistent lower extremity relief from your lower back pain, because it is a continuous therapy. Okay. Like I said, some people will use a pillow, but sometimes it doesn't give you the right amount of support. As you can see in the lower picture on the right, that there is a pretty good gap between the posterior part of both of her knees that's not supported. But with the wedge, there's a nice little seam there that can actually lie right underneath your posterior knees and give you better support with that. Okay. And then this last slide is that people who are side sleepers, we want to make sure that they understand that it's just as important if you're sleeping on your side to keep your spine in a straight neutral position as much as possible. Some people, especially if they have fibromyalgia, they'll find that they need a lot of pillows to support each of their limbs, because if it's just hanging down, it will be very painful. The muscle, the nerves will be very painful. So they will use a lot of pillows. But the main takeaway from this picture is that she's using a lot of pillows, but as you can see, she's done her best to keep her spine in a straight position and a neutral position to decrease her pain. And the top right is the actual lateral wedge, so that if people like to sleep on their side, then instead of using pillows that also can become dislodged, this wedge helps you, will stay in place, and you tuck it in really tight underneath you. And some people who have shoulder pain, they'll use the wedge because you can actually, when you put it behind you, you can actually lean back on it and take some of the pressure off the shoulder that's causing you pain, so that you can sleep more comfortably. Let's face it, some of us are very, very particular about what position we sleep in, and it's hard for us to sleep on our back versus maybe we're better sleeping on our side. So this might be helpful to accommodate you sleeping on your side if you have a shoulder or neck problem, okay? So these are some helpful tips, and it's a really important concept to support your posture and especially your spine in a straight neutral position when you're sleeping, to be able to improve your ability to sleep and decrease pain. So I hope you find these helpful. If any of these supportive devices look interesting, you should probably go online and put in either a lower extremity wedge or a lateral wedge, or a cervical pillow, or the things that we showed in these slides that you might be able to purchase. Sometimes if you go to a really big sleep store, they have all kinds of devices in there to help you sleep, not just mattresses and pillows, but other things. Sometimes they'll let you actually try them for a trial of 30 days, and then if it's not working for you, then you can return it with no money out of your pocket, which might be kind of helpful. But I also caution people not to have your friend tell you, oh yeah, I purchased this and it works great, I sleep like a baby with it, because everybody's different. So what works for them might not work for you. So you might not want to spend a lot of money until maybe you have a chance maybe to try the support that they're talking about, or the pillow. Okay. All right, y'all, looking forward to seeing you again, hopefully on my next video. And I appreciate you spending time with me until we see each other again on the videos. I want you to be safe and sleep well and thrive. Thank you.